If you've been taking pain pills for joint pain but still wake up stiff, struggle to climb stairs, or feel like your knees are twice your age, you're not fixing the problem, you're just masking it. Here's the truth most doctors won't tell you. Pain medications suppress inflammation temporarily, but they do nothing to rebuild cartilage, restore bone density, or strengthen the connective tissue holding your joints together. It's like putting duct tape over a rusted pipe. It hides the damage, but the corrosion keeps spreading. Today, I'm showing you a research-backed nutritional strategy that targets the root cause of joint degradation, and it starts in your kitchen. Welcome back to Health Morph, where we transform complex health science into simple, actionable strategies you can use today. I'm here to help you reclaim your mobility, reduce chronic pain, and build a body that ages with strength, not limitations. Joint pain affects over 58 million Americans, according to the CDC, and it's the leading cause of disability in adults over 40. But here's what most people don't realize. The standard approach, NSAIDs, cortisone shots, and endless physical therapy, only addresses symptoms. The real solution lies in nutritional intervention that supports bone mineralization, reduces systemic inflammation, and promotes cartilage repair from the inside out. In this video, I'm breaking down a science-backed anti-inflammatory nutrient blend that combines ancient wisdom with modern nutritional research. This isn't a quick fix, it's a sustainable system for joint health that works with your body's natural healing processes. Disclaimer: this video is for educational purposes only. It is not medical advice. Always consult a healthcare professional before starting any new supplement, diet, or exercise program. Why joint pain becomes chronic? The real problem. Let's start with what's actually happening inside your joints. Your skeletal system isn't static, it's constantly remodeling. Bone cells called osteoblasts build new tissue, while osteoclasts break down old bone. In healthy joints, this cycle stays balanced. But after age 35, bone resorption accelerates while new bone formation slows down. Add inflammation, nutrient deficiencies, and poor circulation, and you've got the perfect storm for chronic joint degeneration. Most pain medications work by blocking COX enzymes, which stops prostaglandin production and reduces inflammation signals. Sounds good, right? Not quite. While you get temporary relief, you're also shutting down pathways your body needs for tissue repair. Long-term NSAID use has been linked to delayed fracture healing and even increased risk of cardiovascular events, according to research published in the American Journal of Medicine. The better approach: target the underlying deficiencies that make joints vulnerable in the first place: calcium, magnesium, omega-3 fatty acids, antioxidants, and bioavailable protein. The science behind a bone-rebuilding nutrient formula. What if you could combine ingredients that address every major factor in joint health: mineral density, inflammation, cartilage integrity, and circulation? That's exactly what this research-informed blend does. Let's break it down ingredient by ingredient. Sesame seeds, or white sesame. Sesame seeds contain 975 milligrams of calcium per 100 grams, nearly as much as dairy. But here's what makes them special. They also contain magnesium and zinc, which are critical cofactors for calcium absorption. A study in the Journal of Clinical Endocrinology found that balanced calcium-magnesium intake improved bone density markers significantly more than calcium alone. Foxnuts or macana. Foxnuts are rich in calcium, phosphorus, and plant-based protein. Phosphorus works synergistically with calcium to form hydroxyapatite, the mineral complex that gives bones their strength. They're also low in sodium and high in magnesium, making them ideal for maintaining electrolyte balance in older adults. Almonds. Almonds provide vitamin E, a fat-soluble antioxidant that protects joint tissues from oxidative stress. Research from arthritis and rheumatology shows that vitamin E supplementation reduces inflammatory markers like C-reactive protein in people with osteoarthritis. Almonds also contain healthy monounsaturated fats that support nutrient absorption. Flaxseeds. Flaxseeds are one of the richest plant sources of alpha-linoleic acid, or ALA, and omega-3 fatty acid. Omega-3s downregulate pro-inflammatory cytokines like IL-6 and TNF-alpha. A 2020 study in Nutrients found that participants who consumed 30 grams of ground flaxseed daily for 12 weeks experienced significant reductions in joint pain and stiffness. Dried ginger, or sont. Ginger contains gingerol and shogal, bioactive compounds with proven anti-inflammatory and analgesic properties. According to the Arthritis Foundation, ginger acts on the same pathways as NSAIDs but without the gastrointestinal side effects. It also improves microcirculation, which helps deliver nutrients to cartilage tissue. Turmeric powder. Curcumin, the active compound in turmeric, is one of the most studied natural anti-inflammatories. It inhibits NF-κB, a protein complex involved in chronic inflammation. The problem, curcumin has poor bioavailability. That's why it must be paired with black pepper. Black pepper. Black pepper contains piperine, which increases curcumin absorption by up to 2,000%, according to research and Plantamedica. It also enhances calcium bioavailability, making your mineral intake far more effective. Jaggery or rock sugar, optional. These natural sweeteners provide trace minerals like iron and potassium. However, if you have insulin resistance or diabetes, skip this ingredient entirely. Why most joint supplements fail and how this formula is different. Here's the issue with most joint supplements. They contain isolated nutrients in synthetic forms that your body struggles to recognize and absorb. Glucosamine and chondroitin, for example, have mixed research results. Some studies show benefit, others show none. This formula works because it's food-based, meaning the nutrients come with their natural cofactors intact. You're not just getting calcium, you're getting calcium plus magnesium plus vitamin K plus trace minerals in the ratios nature intended. And when you consume it with healthy fats like ghee or warm milk, absorption skyrockets. Common myths about joint health debunked. Myth number 1. You need dairy for strong bones. Fact. Many plant foods contain more bioavailable calcium than dairy, especially when paired with magnesium-rich foods. Myth number 2. Joint pain is just part of aging. Fact. While wear and tear is natural, chronic pain signals nutrient deficiency, inflammation, or poor movement patterns, all of which are modifiable. Myth number 3. Resting your joints is the best treatment. Fact. Controlled movement and weight-bearing exercise actually stimulate bone remodeling and improve joint stability. Immobility accelerates degeneration. How to use this bone rebuilding formula safely. Ingredients and quantities. White sesame seeds, 40 grams. Foxnuts or macana, 40 grams. Almonds, 40 grams. Flax seeds, 20 grams. Dried ginger powder, 5 grams. Turmeric powder, 5 grams. Black pepper, 2 grams. Jaggery or rock sugar, 10 grams. Optional, skip if diabetic. Preparation. Lightly roast sesame seeds, foxnuts, almonds, and flax seeds separately on low heat until fragrant. Let cool to room temperature. Add ginger, turmeric, black pepper, and sweetener if using. Grind it into a fine powder using a high-speed blender. Store in an airtight container. How to take. Mix 1 tablespoon, 10 to 12 grams in warm milk before bed. Add 1 teaspoon ghee for enhanced absorption. Skip if overweight or high cholesterol. Alternatively, mix with yogurt after breakfast if you have weak digestion. Boost results with 15 minutes of morning sunlight, vitamin D production, daily walking or light resistance training. Include moringa, ragi, and amla in your diet. FAQ section. Q. What is the best natural remedy for joint pain and bone strength? A. A blend of sesame seeds, almonds, flax seeds, turmeric, and ginger provide calcium, omega-3s, and anti-inflammatory compounds that support bone density and reduce joint inflammation naturally. Q. How long does it take to see results from natural joint remedies? A. Most people notice reduced stiffness within 3 to 4 weeks and measurable improvements in mobility and pain after 8 to 12 weeks of consistent use. Q. Can you rebuild bone density naturally after 50? Yes, bone remodeling continues throughout life. Adequate calcium, magnesium, vitamin D, weight-bearing exercise, and anti-inflammatory nutrition can improve bone density even in older adults. Q. What foods are highest in calcium besides dairy? A. Sesame seeds, almonds, chia seeds, leafy greens like kale and collards, fortified plant milks, and sardines with bones are excellent non-dairy calcium sources. Q. Is turmeric effective for joint pain? Yes, curcumin in turmeric inhibits inflammatory pathways and has been shown in clinical trials to reduce pain and improve function in osteoarthritis when combined with black pepper. Q. Should I avoid coffee if I have joint pain? A. Excessive caffeine can interfere with calcium absorption and increase bone loss. Limit to 1 to 2 cups daily and avoid carbonated sodas which contain phosphoric acid that weakens bones. Q. Can flax seeds reduce inflammation? Yes, flax seeds are rich in omega-3 fatty acids, which lower inflammatory markers like CRP and IL-6, helping reduce joint swelling and pain. Your joints carry you through life, literally. Every step, every movement, every moment of independence depends on their strength and resilience. But joint health isn't something you fix overnight with a pill. It's something you build day by day with the right nutrients, the right movement, and the right mindset. This formula isn't magic. It's science meeting tradition, a blend of ingredients that work synergistically to reduce inflammation, restore mineral balance, and support your body's natural healing capacity. If you commit to this system for 8 to 12 weeks, along with sunlight, movement, and whole foods, you're not just managing pain, you're investing in decades of mobility and freedom. At Health Morph, we believe your health span should match your lifespan. Start today. Your future self will thank you. If this video helped you, hit subscribe and share it with someone who needs to hear this. Let's build a healthier generation together.